All right, we're going to get started. Good morning, everybody. Welcome to HIMSS and welcome to Las Vegas. I'm Andrew Mellon, Chief Medical Information Officer at Surescripts, and it's amazing to be here. I'm so thrilled to be here. And I'm thrilled to be talking about this topic today of what we call touchless prior authorization. And it's really been a game changer in improving the way patients have access to their medications, removing burdens from providers, and improving the way health plans work. So we're going to talk about that today. Before we jump in, let's just do some quick introductions. We'll start with Angie.
Yeah, Angie Odom. I'm executive director at UNC in ISD, and we have about 18. Like this. Can you hear me? We have about 18 hospitals and 1,400 clinics and over 3,000 providers that prescribe today. So, I'm very passionate about this new feature that Surescripts has. So.
Good morning, everybody. My name is Lauren Hackenberg, and I am representing Optum Rx. I am a senior director of our provider capabilities, which includes prior authorization. Our organization supports 61 million PBM lives, and we also are delegated to hosting 95% of the PA volume for those lives. The product that we're here to talk about today, our mission runs deep. It is helping people live healthier lives, and I think this product speaks to that.
Hi, everybody. I'm Tara Drager, the Chief Product Officer for Surescripts, and we could not be more delighted to be here on stage with these partners to talk about an incredible innovation to improve patients and really every player in the ecosystem that has a touch in prior authorization.
All right, and so let's give a little background of what we're talking about. Terry, you mentioned that this touches every player in this ecosystem. So what does that mean? Well, what we're doing, what we've collaborated and innovated on, is to be able to go from that moment the doctor writes the prescription to share the information with the health plan, have that health plan make a determination all within 30 seconds. And that has changed the game. I've been in the health IT for over 25 years, and it's so rare, if not impossible, to have something where you're helping the patient, you're helping the provider, you're helping the health plan, and you're helping the pharmacy. You're doing all of this without one click, one element of training, one additional bit of work. It just happens all in the background. So we'll talk a little bit about how that happens, but more importantly, let's talk about the impact that's having. And we'll start with really the most important person, the most important stakeholder in this process, which is the patient. So let's start with this first stat. Those prior auths are being approved in 30 seconds. But what does that 30 seconds really mean? It's 30 seconds from the time the provider clicks, I'm done with the prescription, till that prior auth has been approved. So 30 seconds from when they've completed their thought process, they've talked to the patient, and in those 30 seconds, we've shared that clinical information. Optum and the health plans have evaluated that evidence, and they've created that determination, again, without additional bit of work. So 30 seconds to the patient, what does that mean? Angie, what does that mean to do this in 30 seconds?
So I have personal experience with this. So my medication that I'm on is I'm a diabetic, and to get that authorization, it was taking over 3 weeks to get it. And so I went, I guess, probably about 2 weeks without medication because of the prior auth. So now it's going to go through because I'm a diabetic, and it's going to go through very fast in 30 seconds. So I can get it the same day that my provider orders it. So I'm excited about it. Very excited.
For your members.
Yeah, for our members, our typical EPA process, so we have focused years on driving EPA adoption. We're up to about 88% of all of our PAs are authorized, come in through our digital channel. Our standard process has prior auths approved in 8.5 hours. This capability and innovation has reduced down to the 29-second mark. So absolutely fantastic. Patients can now have access to these medications, or at least to the pharmacy, before they even leave the office.
It's truly, truly incredible what we're able to do here. The people here, we all represent really informed patients. We sort of know how the healthcare system works. We have an appreciation for it. But when we think about the average patient or average family member, they don't know or understand or have sort of the same healthcare literacy. So to take all of that burden away from patients and not have those delays is just, it's huge. And it will be invisible and a little bit thankless, but it's absolutely the right thing for us to be doing for patients to take out this burden.
All right. So thank you. Let's move to the provider now. And, in the typical prior auth process with providers, the provider writes a prescription, someone in the back office learns that a prior auth is needed, they fill out the data, they submit it, and they're submitting it electronically prior auth. But that process takes minutes and days to get done. And one of the other challenges is the quality of data. It's that person who's filling it out manually has to search through the chart, find the information, fill it out, and they have to do it at a high quality level, and that's can be challenging. So one of the really unintended benefits of this was the reduction in denials for providers. In fact, there's been an 88% reduction in appeals because these prior auths that are going through are being submitted with high quality evidence and are being approved instantly the first time. But what has that meant to you at your organization to see that reduction of appeals?
So, the providers, when I meet with them, we have meetings with them and groups and whatever. This is one of the biggest pain points that they have is around the burden of the prior authorization, the manual burden. They have to find the information. Their clinicians are tied up doing that versus taking care of the patients. So they're very frustrated. So when I went to present this technology that we have just implemented, they were ecstatic and they could not, they said, this is life changing for them. So they're excited about this for the provider and the clinicians, the nurses that have to do this, because it's a lot. It's a lot.
I would just add that, we're getting it right the first time, which the frustration comes with the administrative burden and the back and forth. So if we can get this right the first time, in addition to the 88% reduction in appeals, we're seeing a 75% reduction in lack of information denials. So that speaks to that back and forth that you're speaking to of just making sure, did we get this information? Is it the right information? And I would just underscore all of that with we are running 100% accuracy. So when we think about it, it is true codification. It is not a large language model. There's no AI. It is 100% accuracy. Really speaks to getting it right the first time.
The thing I love about this stat in particular is, well, we say it's about the provider. This impacts everybody. So 88% fewer appeals, that is a more efficient payer. That is a patient that isn't having to learn, well, what is a denial? What is an appeal? Again, it touches every member of the ecosystem associated with PA, and there's just not many opportunities where you get that rarefied win-win-win for everybody involved. So it's just really, really exciting.
So thank you. And we talk and across HIMSS, you hear people talk about automating processes. What does automation really mean? Well, for us, what it means is taking the work that's already done, taking the work the provider has done by documenting that patient clinical information, putting in the chart, putting in the EHR, and automating by pulling what's needed and bringing it and taking that evidence and sharing it with the health plan. That's what automation means. And when you do that in an automated way, again, you see things like being able to approve in 30 seconds because there's not a human in the loop. And I think one of the things you said, Lauren, is really important. You'll see many of things here talk about AI, but what we're doing, because we wanted this to be accurate, want to be precise, we are not using AI for this. We are just pulling the data that exists in the EHR in a discrete and deterministic way to make sure it's accurate, it's right, and there's no chance of incorrect information, no chance of hallucinations. So now from a health plan perspective, Lauren, talk a little bit more about what automation means to you, and now that 62% of these prior auths are truly automated.
Yeah, so I would point to our health plans expect us, we have the privilege of serving that 95% of our delegated population. In that, clinical rigor is absolutely paramount. So what you're speaking to is we're getting it right the first time. We have the actual codification, the documentation that meets CMS guidelines. But what that does for our teams too is we're taking the noise out of the transaction. We would actually argue that there's more clinical rigor when we're pulling that clinical information from the EHR versus the manual entry that goes on with prior authorization today. So yeah, I think that this all around, when we think about the stakeholders, our health plans have skin in the game and they're excited. The 62%, one additional note, the first health system that we went live with, we had one class of drugs go live as our beta, GLP-1s. I'm sure it's not a shock to a lot of folks, but GLP-1s made up 55% of their overall PA volume coming inbound to Optum Rx. So when you think about 55% of the volume of one drug class, 62% of approvals being automated, we're making a tangible impact here with every beta site that we're rolling out. So just would encourage people, we've now also increased up to 40 drugs that are available in the program. So that expansion is naturally occurring.
Yeah, and our goal here at Surescripts is to support our partners, all of our network partners, whether it is Optum Rx to expand the number of medications that we're able to automate, provider systems that are able to adopt this technology so they can use this touchless technology, and all of our network constituents to partake in this and grow the impact across the entire ecosystem. Because when you think about that 62% impact at scale, it's transformative to the entire industry. So this is our top priority as a business, to scale this as far and wide as we possibly can.
And increase the number of medications. Continue.
Absolutely.
Yeah.
No pressure.
All right. Well, let's talk about one other really important stakeholder in this process, the pharmacy. So, if you haven't personally had the experience of ordering a drug or having a drug prescribed to you that required a prior auth, this is a typical process. Doctor writes the drug, prescription goes to the pharmacy tries to run a claim, the claim comes back, prior authorization needed. They send a notice to the doctor's office, maybe fax. The doctor's office has to see that notice, go to a portal, type in the information, you know, kind of dual screen between the EHR and that form, and then get it approved. And then the patient can pick up the drug. And that's days. That's not usually minutes. That is days or even weeks. And so what we're seeing with this is that time that it would take on average has gone from 4 days to get the drugs the doctors prescribed to essentially none. That is approved the moment the doctor's written the prescription. And so that changes the experience for the patient when they interact with the pharmacy and makes the pharmacy's experience much better. So that pharmacist isn't telling the patient, I need to go to talk to the doctor for a PA. So Tara, let's go into this a little more. Like, what does this mean for the pharmacy?
Yeah, so I think if anybody can think about their last experience at the pharmacy, or if you have friends that are pharmacies or pharmacy techs, think about what their experiences are like today. It's a long line, and so if a patient is perhaps they have a new diagnosis, they're starting a therapy for the first time. Maybe they're excited about it, maybe they're a little bit nervous, and you show up to the pharmacy, you wait in line, and it's your turn, and you can't get your med. And for some patients, that might have been their one opportunity that week to have transportation to that pharmacy. And so that is time where the pharmacist and the tech isn't able to help somebody else. It's time that impacts the patient. And so now with this reduction, it's 30 seconds. The patient walks in, they can get their medication, they can get started faster. And I think I'm going to hypothesize that over time, we will see this directly impact adherence. I don't have the stat yet because we're not far enough along, but I think if patients can get their meds faster, that's just that much less time to change their mind or have some sort of friction get in the way.
Yeah, and I will add, there's a lot of phone calls that the patient does, right? They're calling the pharmacy, then the pharmacy says it's at the provider's office. They call their provider. They say, well, it's at the insurance company. They're calling the insurance company. I'm in healthcare, so I know all these things. But the average, the people that are not, they're confused because they're being told it's here and here and here. So it's very frustrating.
I'll just say, as a licensed pharmacist myself, I would be thrilled to obtain a clean script that can adjudicate, and you can then practice at the top of your license, do more immunizations, whatever it may be, helping patients, are there lower cost options that may be available, whatever the discussion may be, but you're not worried about trying to triage the prior auth, following up on the phone calls that you're talking about. really enabling some higher level service. So it's really exciting to see this come forward and take that burden away from pharmacists and pharmacy techs as well.
And so let's kind of recap a little bit of what we heard. And I just want to say one thing, we started this, we started talking about this talk about 40 minutes ago, 45 minutes ago, we were planning. That's about how long it took to implement with you at your organization. I heard the phone call for the implementation took about 45 minutes. And that's how simple this is to connect to the health system and get this going. So this has been something that's been a win for patients. They're getting their drugs faster. So win for providers. We've taken the work they're already doing in the EHR and bringing it to the health plan for that evidence. So they're not filling out forms. It's all happening automated. It's a win for the health plans. These are accurate determinations. You're not doing appeals, and you're able to automate this because you have high quality data. And for the pharmacies, they're getting that clean script the first time. When the patient leaves that doctor's office and shows up at the pharmacy an hour later, that medication that they've been waiting for and it's going to help them is ready. So, what I've heard all of you talk about is how do we go faster? Like, what can we do as a community, as an industry, to bring this innovation to all the patients? So I'll start with you, Tara. What can we do?
So for us, the ask is this innovation is here, it is real, it is transformative, and the faster we work together, the more plans we bring on, the more medications we bring on, the more providers we bring on, the more impact that we can have to patients and improving their lives and making healthcare just a little bit easier because it is already hard enough for any patient that is facing some sort of change or disease or sickness in their life. So come talk to us if this is something you want to get started with or learn about or understand how it can fit into your particular organization.
I would double down and say, yes, Optum's participating in this, but we really looked at this as a network solution and looked to SureScripts to help bring that to life. If there's anything from a PBM perspective that we can help, we're here, we're open doors. And then also the volume. The more volume that we get on the tool, the more drugs and the more plans that we can bring on board and drive the automation higher.
Yeah, and I'll add that the implementation was very, very easy and very quick. So it was well worth it. The team that we had at SureScripts was awesome. And yeah,
And what kind of training did you do for your providers?
so not really not. You kind of tricked me there. It's like we didn't have any training because we actually had a silent go live and for a week, and then we announced it the next week. So they didn't even know it was happening, and we are at a 43% rate that's getting approved of the ones that are going through. So we're very excited about that.
Yeah, I think that's a great one to wrap on. There was no training. The providers didn't know that, but 43% of those PAs that would have taken days, that would have taken manual labor, that would have taken work, would have caused delays for those patients, got done in 30 seconds. I think that's pretty incredible. I want to just thank Lauren and all the collaboration you've done with Optum. You have been instrumental in this. You, Angie, and the work you've been doing to help bring this live and help us, really start to scale and grow it. And I look forward to any questions and answering any topics around how we can bring this broader in the industry. So thank you so much for listening. We're up here if you have questions, so please come and talk to us.
And get
Thank you.
signed up quick because it's really worth it.